Okay. So our attendees are climbing. All right. Welcome, everyone. We'll be getting started soon. We're just going to let people gather here with us virtually. Welcome to the virtual experience. All right. As far as the time goes, you guys will look for the time, right? You're supposed to stop. If not, I'll say something, but I'm sure we'll fly right through. Mm-hmm. All right, we got 3 more minutes and we'll get started. All right, our attendees are rolling in. Good. They can't see us yet. Not our faces yet. All right, everyone, we have about 1 more minute and then we will get started. I'm very excited right now. Our attendees are climbing. It's just like looking at the pop charts. We're popular, you guys.
Yeah, I can see on the side how many attendees we have here.
Mm-hmm.
Or
Yeah,
how
they're
many.
climbing, we're waiting. Okay.
And India, does Shannon set up, does she set up the webcam, or not the webcam, but GoToWebinar?
No, I actually set everything up. It's just her, I guess like our accountant's in her name. So that's why.
Okay.
I probably could have went in there and changed that, but I didn't. All right, you guys. So it's 10:29. We're going to start at exactly 10:30. And it's 10:30. All right. All right. All right. Welcome, everybody, to our Transportation Equity Forum Series 1. Today, I'm just really excited about everything that we have in store. This series has been brought to you by the Ohio Aging and Disability Transportation Coalition, Services for Independent Living, United Way of Greater Cleveland, and the Ohio Department of Transportation. We have two very, very great speakers today. We have the community navigation trainer and coach at United Way of Greater Cleveland. She goes by the name of Molly Black, and that's who we're gonna have presenting to you first. All right, Molly, I'm gonna go ahead and hand it over to you.
Okay, great. Thank you so much. Hi everybody. My name is Molly Black, and I'm with the United Way of Greater Cleveland's 211 HelpLink. And today I'm going to tell you a little bit about 211 HelpLink and also about a partnership that we have with Lyft. Go ahead, you can advance.
All right, it's not going. One moment. There you go.
Okay.
Is that the right slide?
Oh, here we go. All right. Okay, so 211 is an easy to remember 3-digit telephone number that serves as a gateway to connecting to health and human services 24 hours a day, every day of the year. This service is free to the public. It's available in any language needed. We have a 24-hour language interpretation service that we use so that we're able to help anyone who speaks any language. And our organization is accredited by the Alliance of Information and Referral Systems, also commonly known as AIRS. And approximately 93% of the US population has access to a 211 service in their area. You can go ahead and advance.
There may be a little bit of a delay, so if you don't see it, go to the next slide. I did press it.
Oh, okay. All right. I'm still seeing the old slide.
All right, give me one moment, everyone. Thanks for being patient.
Okay.
While I'm trying to go to the next slide, Molly, how long have you been with 211 exactly?
Well, I started out my career with 211 working at the 211 in Summit County, and that was back in 1999. I worked there for 5 years and then moved to the 211 service in Cleveland. I'm originally from Cleveland, so I was happy to be able to move back home, and I've been there ever since. I have worn many hats since I've been there. I started by taking calls, being one of the navigators on the phone, and supervising different projects. Oh, wait, there it goes. All right. So this is what you're seeing here is a map of our coverage area. We have contracts with Cuyahoga County, Geauga County, Darke County, and Ross County to provide 211 service 24/7. And then temporarily during the pandemic, we've took on a few additional counties to ensure that all of Ohio is covered during the pandemic when folks really need it. So our temporary coverage includes some pretty rural areas, Coshocton, Van Wert, Jackson, Gallia, Meigs, Scioto, Vinton, Allen, and Lawrence counties. And we're at this point, the plan is to cover those areas through the end of the year, and then we will see what what happens from there, if we get an extension on that or not. Go ahead to the next slide.
We're having technical difficulties right now. I really do not understand it. But maybe
Okay.
your map just looks so great that we needed to focus on it a few extra minutes. Okay, so I'm trying to go to the next slide. In the meantime, do you think that you saw a decrease or an increase since COVID happened as far as people kind of contacting you guys for your services?
Gosh. Oh, a huge increase. It's been incredibly busy. We've had a lot of folks reaching out to us for the very first time. People who have, worked their whole lives that suddenly are unemployed, or whose hours have been cut at work. A lot of folks have been had difficulty with obtaining their unemployment benefits, and so, of course, that leaves a need with with basic needs. So a lot more folks calling about food and rent and
Right, right.
utilities and those sorts of things. Okay, so I'm seeing the next slide. How to reach us. So we're available by phone 24 hours a day, every day, just by dialing 211. And also, we are available by chat 24/7 at www.211oh.org. So for folks that prefer to chat versus a phone call, that's an option. I know we get a lot of social workers that are kind of in their office multitasking, that are reaching out to us by chat, and then we are able to email any information on resources that seem like they'd be a good fit for their clients. You can go ahead to the next slide. Okay, so I wanted to talk a little bit about our process. So essentially what happens is, first, a person has a need or a concern and they reach out to us. A professional specialist listens, asks questions, and clarifies. Then the specialist will search our community resource database for some potential programs that could be helpful. And the person and the specialist work together to develop a plan, and then the specialist will follow up with the person if it's needed. Next slide. Okay. So in this slide, it kind of goes along with a story of a caller that I actually spoke with when I was taking phone calls. We take a holistic approach to addressing our clients' needs. I had a caller once who had told me that she was looking for some assistance with furniture. And, so I reassured her, okay, well, sure, I'll help you out with that. Let me take a look and see what I can find. But can you tell me a little bit about your situation? Did something recently happen that's causing you to need furniture? Was it, are you moving out of a shelter? Did you have a fire, bed bugs? Like what's happening? Well, it turned out that this woman had been in a domestic violence relationship for several years, and she had finally had enough, and she was ready to to get out of that situation. And she saved, she scraped together every like last cent that she had and put down first month's rent and deposit on an apartment. And then once she did that, that just wiped out every bit of savings that she had. And she didn't have any money left over to furnish this apartment for her and her child. So, you know, I reassured her that I'd get her some options for furniture, but then I wanted to talk a little bit more about, you know, her domestic violence situation. So, you know, I had told her about the Domestic Violence and Child Advocacy Center, and, you know, she immediately was not very interested, and she's like, no, I don't need any shelter. You know, I've got this apartment, I'm fine. But I was able to tell her a little bit more about some of the other services that they provide that she was not aware of. So, you know, I told her about some of the counseling that they would potentially be able to provide for her and her child, support groups, some legal assistance. She was married to the abuser, so she was, you know, looking to get a divorce. And get a protection order. So those are all things that they could potentially help her with. And she was just surprised. She didn't realize that their services were so comprehensive over there. So as we continued to talk and as I built a rapport with her, she disclosed to me that, you know, the whole reason that she's been sticking around with this guy that's been abusing her is because she had diabetes. She was insulin dependent, and she worked, but at her job, she didn't have access to health insurance there, and so she was staying married to this guy because she was covered under his health insurance policy. And you know, for any of you that that have diabetes or know somebody with diabetes, you're well aware that insulin can be, you know, cost somebody hundreds of dollars a month. And that was just something that she didn't have. And so she was kind of weighing her options here of like, well, do I manage my diabetes and continue to be abused, or do I leave the abuser and then worry about where I'm going to get my medication? So I talked with her a little bit about that and about her income, and it turned out that she would be eligible for Medicaid. So I gave her information on how to apply for that, as well as some information on a program that could provide some immediate assistance with her medication until the Medicaid application went through. And so it's just, and this story gets just a really good example of what happens when people call us. A lot of times they will tell us about one, they're just so concerned about like one immediate need, but we're able to kind of help them with their entire situation. And so we're going to be asking questions and probing to, you know, we don't want to just put like a little tiny Band-Aid on a gaping wound. We want to be able to like actually address the root of the problem, like in this situation. Go ahead to the next slide. I don't know why the layout of these slides is acting all funky. I apologize for that. So I had mentioned earlier a little bit about our community resource database. And our database contains approximately 4,000 social service, health, and government agencies that have over 7,000 separate locations and more than 24,000 unique programs. The content of this database is researched and created and curated by a team of 5 professional content specialists. And these guys make approximately, well, over 150,000 updates annually. So there's a little picture of our team right there. Go ahead to the next slide. Okay, so every year, our resource team does an extensive annual update for each agency that's in our database, and they update they just ensure that every detail that we have about each program is accurate and up to date. And then we also will do interim updates throughout the year, and these are initiated in a variety of ways. So sometimes the agencies will reach out to us directly to alert us of changes. Sometimes our clients will call us back and say, hey, you know, that program that you referred me to, there's been some changes. So they alert us, and then our team will reach out to the agency to verify or confirm any sort of changes that need to be made. Our resource content specialists will attend community meetings. They monitor local print, online, and social media for updates. And then when they make these updates, they are available in real time to the specialist. So if we have a resource specialist who is on the phone with an agency updating information, as soon as they hit save, our navigators, who are the folks that are on the phone and on the other end of the chats working with the clients, will see those changes immediately. Next slide. Okay, so with the database search, the navigation specialist is first they're gonna establish some rapport with the client. They're going to assess the needs of the individual and identify those needs, prioritize those needs, collect some demographic information. And then once all of that's complete, then that's when we begin a search. And so you'll see there's a little screenshot of what it looks like in our database, and just kind of keeping with the topic. Right here is just an example of the beginning of a search for medical transportation for a 77-year-old female living in the 44114 zip code of the city of Cleveland, Cuyahoga County. All right, next slide. Okay, so here's another screenshot. I ran that search for medical transportation for the 77-year-old female in 44114 zip code Cleveland. And you can see like towards the top of the screenshot, it says search results match list for locations. So in this example, we have 4 potential programs that come up for someone with those demographic pieces that I entered into the database. So potentially we have 4 programs that could help a 77-year-old female in 44114. And you can see that our LIFT program is at the top of the list there. You don't see an all-inclusive list just because of space. Go ahead to the next slide. Okay. If after reviewing the details of the programs that are returned during the search, if the navigator discovers that none of those options are really a good fit for the client, then they're going to expand their search to include similar types of programs that may still be able to meet the client's needs. So in this screenshot, you'll see I modified the search to be for general paratransit, community rides programs, senior rides programs, and disability-related transportation. So these are all things that they're not exactly the same thing as medical transportation, but these types of programs could still potentially take somebody to some sort of medical appointment. Next slide. So the next couple of slides, it just kind of gives you an idea of the level of detail that is that's put into our database on each of the programs that we have information about. So I've chosen to use our LIFT program here. I'm not going to read the whole slide here for you, but what you can see is that the type of information that we keep is the name of the agency, address, contact information, a description of the program, how the service is provided, details on who qualifies. And then you'll also see towards the top of the slide that we have options to send our clients the information in our database via a text or an email. Generally, the texts are pretty short. They don't have a lot of detail, but they do have contact information. Whereas we can send you or your client an email with information about a program, and it'll be all the full level of detail that our navigation specialists are seeing. Go ahead to the next slide. Okay, this is just a continuation of the information that we would have about a program in our database. You'll see we would keep hours of service, fees if there's any sort of fees involved with the service. If there's any sort of required documents, those will be detailed out in there. Instructions on how to access the program. And then also if there's any particular contact person that they need to ask for. It wouldn't necessarily be the name of a person, but it would be like their job title, like maybe, like for example, here it says 211 specialist, but it could say intake specialist or asked to speak with the social worker or, you know, whatever the case may be. Next slide. All right. So now I want to talk a little bit more specifically about the United Way LIFT partnership. So for the last 3 years, United Way Worldwide has partnered with LIFT and several local 211s in order to provide free transportation for those with transportation barriers. And this year, the program includes 18 local markets across the US, and United Way of Greater Cleveland is one of those markets. Next slide. So this is, it's the 3rd year of the program. It's also our 3rd year participating. The first year we used our rides for those that were either seeking employment or who had just started a job and have not yet received a paycheck. However, we it changed that during our 2nd year and decided that we wanted to use those rides instead for medical transportation for seniors. And this year we are continuing to serve that population and serve that need. Next slide. I don't know if you heard my husband sneeze. He's sitting next to me. Sorry about that. Okay, so the program is set to last through the end of the fiscal year, this fiscal year, 2020-21, or once the funding is depleted, whichever comes first. We are hopeful that United Way Worldwide and that LIFT are going to continue to partner with us beyond this fiscal year. However, if and when the program funding does end, our navigators will still continue to help our clients with transportation needs by screening them for other programs in their area. Next slide. Okay, so the program parameters. We have a loose definition of what we mean by senior. So it's for Cuyahoga County residents age 55 and older who need transportation for non-emergency medical appointments. And that would include eye care, dental care, mental health services, or substance abuse treatment. And the rides can also be used for return trips from the emergency room. And I had to put this big disclaimer in here because of the pandemic. The rides cannot be used for COVID-19 tests, and it cannot be utilized by anyone who's experiencing symptoms of COVID-19 or by anyone who has recently been exposed to someone who has COVID-19, and masks are required for all riders. Next slide. Okay, so this next section is just all frequently asked questions about the 211 HelpLink Lyft program. What is Lyft? Lyft provides on-demand automobile transportation service for adults. Lyft screens and hires local drivers as independent contractors. How do I access a ride through this program? Call 211 for either an on-demand ride or schedule a ride up to 3 days in advance. On-demand rides are rides when the 211 HelpLink specialist will request a ride to be dispatched immediately. In most cases, a ride will be available within minutes. Next slide. Okay, so I wanted to kind of explain a little bit about what I mean by in most cases, the driver will be dispatched within a few minutes. So this is kind of a bit of a disclaimer here. So ride access is based on driver availability, and Lyft will attempt to dispatch a driver for up to 30 minutes. And if they cannot find an available driver within that time frame, then the ride request is canceled and the rider can try again later. This tends to be more of an issue in rural areas where there just aren't as many Lyft drivers. But this is really rarely an issue in urban and suburban areas like Cuyahoga County, because there's just more contractors that are working for Lyft. And in the 2.5 years that we've been doing this, we've only had a very small handful of incidents of this happening. Primarily it happened early on in the pandemic, and then sometimes we have that happening in times of very severe weather. So if we're in the middle of a snowstorm, this could potentially be an issue. However, outside of that, we generally are able to get rides pretty quickly. Next slide. How will I know which car to get into? So if the client has a cell phone, then once the ride is dispatched, they're going to get a text message that has the driver's first name, the make and model and color of their car, as well as their license plate number. Next slide. If the client does not have a cell phone and they need a ride right away, then they're going to be asked to just remain on the line with the 211 specialist until the driver is dispatched, and then the 211 specialist will relay all of those details to the caller. If the caller does not have a cell phone and needs to schedule a ride in advance, then what will happen is they're going to receive an automated phone call a few minutes before their pickup window that is a recording that provides them with the information. So I would just caution, if you have clients that are going to utilize this and they don't have a cell phone, they're going to want to make sure that they're near their phone right when their window, a few minutes before their window starts, because they're only called once. It's just an automated call, and so if they want to make sure they're getting the details about their driver, they just have to be close by their phone. Next slide. It's not advancing.
All right, it's showing a different, you see it now? Okay.
Yes, I do. Okay. Whoops. Oh, you went ahead one. But that's okay. I'll just talk about the content on this slide. So what if your client needs to cancel a pre-scheduled ride? If your client needs to cancel a pre-scheduled ride, we would just ask that they contact us, give us at least 1 hour before the ride is scheduled to happen, so they can cancel up to 1 hour prior to the ride. I think we missed some slides in here, but that's okay. I'll just talk about this slide. So can my service animal ride with me? Yes, if you have a service animal, a registered service animal, then they can ride with you. And then if you have a client that leaves something behind in the lift, they should just call 211 as soon as that they're aware that they've left something behind. And then the specialist who answers the phone will reach out to Lyft, and Lyft will contact the driver. One of the slides that was skipped over, I believe, was about mobility aids. Lyft does not have very many drivers that have wheelchair accessible vehicles. However, if the person has a mobility aid that can be folded up and that can fit in the trunk of a standard size sedan, then they would be able to accommodate them. The rider or whoever's with them to help them would have to be able to put that mobility aid in the trunk. And then I can't remember if there was anything else that was missed on any of those slides. So I'll just go ahead and stop here. I think, Shannon, are you going to provide everybody with copies of the slides that's attending?
Yes, so everybody that
Okay.
attends, we have an email address for them. So they will receive a copy of, I'm going to also upload this recording on a few of the websites. So our partnering people who actually were gracious enough to do this with us, along with our website, and they'll get an email with you guys' information and anything else that they may need. We'll also have a segment here at the end for questions and answers. Thank you everybody for being patient, having a couple of technical difficulties over here, but Molly, you still did great. And the main reason that I wanted Molly to be a speaker for today is because I really thought that was awesome that they had a partnership with Lyft, because as we know, we all have caught a Lyft before, or an Uber, or what have you, and it's never free. So if somebody really is in need, it's awesome that they can actually reach out to 211, and that transportation is something that they put in the making to be able to help individuals that are in need for non-medical type of transportation. All right, so thank you so much for your presentation. Very informative. Now I'm going to try to switch the screens, you guys, and thank you again for being patient here because it's really acting weird, as you can see. I'm going to stop sharing my screen for just a moment. We'll act like this is a little 1-minute intermission. Thank you. All right, you guys, and now I am back. All right, so for the next speaker that we have in place, we have Kierra Branch. She is the program 55310 program coordinator that is located in Columbus, Ohio for the Ohio Department of Transportation. And Kierra, I just want to thank you again for agreeing to be a speaker. And of course, you have the floor now.
Hi, thank you, India, and hi, everyone. Welcome to the Transportation Equity Forum. My name, again, is Kierra Branch. I am the 5310 Program Coordinator within the Office of Transit at ODOT, Ohio Department of Transportation. And before we start the presentation, I wanted to give just a little bit of background about myself and my transition to ODOT. And India, you can advance to the next. There we go. So I actually transitioned to ODOT back in February. So I've been with ODOT for about 7 to 8 months now. Prior to coming to ODOT, I actually served as the senior legislative aide for State Senator Sandra Williams, District 21 out of Cleveland. I'm in the Ohio legislature, more specifically the Ohio Senate, where I advised the senator on policy centered around higher education, workforce development, and affordable housing. And India, you can advance. Perfect. And today I wanted to give just an overview about grant opportunities that are available for agencies seeking to remove the barriers of transportation for individuals with disabilities and senior citizens. So the purpose of the 5310 grant, also known as the Specialized Transportation Program. So the purpose of the program is to enhance the mobility of seniors and individuals with disabilities by removing barriers to transportation services and expand those transportation services that are designed, planned, and carried out to meet the special transportation needs of seniors and individuals with disabilities. So to sum that up, the 5310 program does provide funding to different projects within the state of Ohio that seek to remove those barriers to transportation for that segment of population. And it is also important to note how FTA does define a senior and then a person that has a disability. So a senior is anyone defined, or any person that's defined age 65 or above, and then a term disability means with respect to any individual that does have a physical or mental impairment that substantially limits one or major life activities of that specific individual. You can advance to the next slide. It's also important to note that any project that is funded through Section 5310 must be included in the coordinated plan. So that is an FTA requirement. And what a coordinated plan does is it identifies community resources for transportation and mobility in that specific area. So it's a plan that has been developed through the lead agency that really seeks to understand the gaps and unmet needs within those services and within those counties that seek to address those gaps of transportation barriers. And projects, again, are to be included for any 5310 funding that they receive, and those plans must be ODOT approved. And ODOT actually has a coordinated template and guidance, which I have the link for as well. I do believe India is going to send out the presentation, so the links will be provided in the PowerPoint. Alrighty, so eligible recipients. Who is actually eligible to receive funding through Section 5310 or apply for Section 5310? So any private nonprofit organization or state or local government authority. Now, if you are a state or local government authority, you do have 2 additional requirements or 2 provisions under that specific requirement, which is to certify that there are no other nonprofit organizations in the area to provide such services. We want to make sure that through the 5310 program that we are not funding duplication of services. So we do have that requirement, and then that state or local government that is also approved by the state to coordinate services for individuals with disabilities and seniors as well. And India, you can advance to the next. Okay, perfect. And then any eligible projects. So there are several eligible projects under the 5310 program, which includes computer hardware and software equipment, operating assistance, mobility management, preventative maintenance for 5310 funded vehicles only, and then vehicles as well. And I'll kind of go in a little bit of more detail about each specific project. Now, with these projects that we have listed, Thank you. With these projects that we do have listed, an agency can say, oh, well, I don't have a vehicle, or I'm not applying for operating mobility management or a computer, but I want to know if maybe my volunteer driving program is under these provisions as well. So what I do is I work with agencies and kind of get the details of their project to see if it is able to be eligible under 5310. So this is not just an exhaustive list of the actual projects, but those projects that the applicant does apply for must be within the program goals and mission of that actual program. And so I wanted to talk about vehicles as well. And India, you can advance to the next slide. Perfect. So vehicles are to be used for the program related needs for which the Section 5310 grant is made. So those vehicles must be used to bridge the gap between transportation needs and unmet needs for individuals with disabilities and seniors. And any vehicle that is awarded through the program must be in compliance with the contractual rights of the program. So we do have just additional reporting requirements as well. And ODOT also provides the agency with a list of available vehicles when they apply for a vehicle project. And then the program coordinator, which is myself, I would actually work with the vendor and the agency to select that vehicle and also provide the specifications of that vehicle as well. We do have a more extensive vehicle ordering process, but just for time purposes, I wanted to discuss that we do work with the vendor and the vehicle agency in order to order that. And you can move to the next slide, India. So the local share payment. So FTA does provide 80% funding for capital projects. So this includes capitalized maintenance / preventative maintenance, and then also vehicle projects as well. And then the local share match of 20% is provided by the actual agency. Now that 20% local match is based on the price of the vehicle that is selected in the vehicle cost worksheet. So we actually send an agency a vehicle cost worksheet, and that agency will fill that out and send that to the vendor to have it approved and to build that actual vehicle. And from that price that's actually on the worksheet is where the 20% is calculated. And then different sources of local match that an agency can use can come from revenue from human services contracts, such as JFS, private donations, or any dedicated tax revenue. And India, you can advance to the next slide. And then here are a few available vehicles that are listed on some of our vehicle cost worksheets. So we have light transit vehicles, such as narrow, fiberglass over steel, low floor, and honeycomb, which are just different specifications of those vehicles. And then vendors also offer accessible vans or modified minivans. Now, agencies can also contact ODOT, or they can contact the vendor and say, hey, we're looking for this specific vehicle and we want these different specifications. And ODOT and the agency and vendor, we can all work together to see how we can provide that specific vehicle. So agencies are able to select the vehicle they think would best fit for their program and the goal of the service area. And then another eligible project, again, is capitalized maintenance. And with capitalized maintenance, FTA does provide 80% of the match, and then the agency does provide the local match, which is 20%. And then India, if you could advance to the next slide. Perfect. And then the capitalized maintenance, that is a project that's used for any materials, labors, and the functionality and serviceability of that specific vehicle. So if there's any maintenance that's done on the vehicle, such as if the vehicle needs a new roof or it needs a new floor, there are doors, or any oil changes that need to be made on the vehicle, anything that requires the vehicle to be taken to a maintenance garage would be considered capitalized maintenance. Now, one important thing to note is that this grant or this project is only available for ODOT 5310 funded vehicles. So an agency could have several vehicles within their fleet, but they are only able to claim the expenses and the cost on those specific vehicles in which they acquired under ODOT Section 5310. And then the reimbursement, we have a reimbursement process as well. So again, FTA does provide that 80%, and then the agency does provide the 20% local match. And in order to receive that reimbursement, in order to receive that match and that reimbursement, an agency would submit their invoices to ODOT quarterly. So they would actually submit those invoices to me. One is due April 15th, July 15th, October 15th, and then also February 28th. So it is on a quarterly basis. And in this invoice, an agency can submit all of their expenses on that specific vehicle and all of their revenues as well. The program coordinator would then review that actual invoice, and then we would submit that. If it's in good order, we would submit that to our finance department for that reimbursement. And before we actually have our agencies or subrecipients invoice ODOT, we do conduct an invoice training before the calendar year begins. And you can advance to the next slide. You can advance to the next slide. And one more slide as well. Perfect. So equipment, computer hardware, and computer software are also different projects that can be funded through Section 5310. And again, this is particular to any 5310 funded vehicle that is eligible under the program, and then ODOT will reimburse 80% of the total project costs up to the contract amount. We do encourage our agencies that before they actually purchase the equipment, that they do contact ODOT to let us know that they are going to purchase that equipment so that we can ensure that they are in procurement policies and requirements. And then from there, they will submit documentation to ODOT, and we will review and submit that over for that reimbursement. You can advance to the next slide and one more slide. Perfect. So operating assistance is also another project that is able to be funded through Section 5310. Now, operating and capitalized maintenance do work just a little bit differently with the funding requirement and the funding split. So FTA for capital projects do provide the 80%, but with operating, that they do provide the 50% funding, and then the agency comes up with the 50% local match. The reimbursement invoice does work the same as it does with capitalized maintenance. It is just the funding split that is different. But the interesting thing about the operating invoice is that it can be included for all of the fleet that an agency has. So again, an agency can have vehicles within their fleet that they receive from large MPOs or they receive locally. With operating, they're able to claim all of the expenses for all of the vehicles in their fleet, which covers driver salaries, items having a useful life of less than 1 year, and any fuel on those vehicles as well. And India, you can advance to the next slide and one more slide for me. Perfect. So now that we've kind of discussed the overview of the program and the different projects and eligible subrecipients, now we can discuss the actual application and how to apply, because that would be important. So in the application period, there are 3 phases to that period. There's a letter of intent, the mandatory application workshop, and then ODOT's grant management system, in which is Black Hat, in which the application is actually submitted. So the letter of intent is due every year in February. Now the date usually changes, but for the most part, the month has always stayed the same. And that letter of intent is actually completed in our form stack system. And this form here determines interested applicants' eligibility to apply for the program. So on the just basis of the application, we're really looking to see, is this a nonprofit organization? Has it actually satisfied the requirements and the program mission, and then also to the funding requirements of the project as well. So we're really looking to see, just from the letter of intent, is this applicant eligible to apply? And then if the applicant is eligible to apply and that letter of intent has been approved, that is when that applicant will be invited to attend our mandatory application workshop. And then once the requirement of the mandatory application workshop has been satisfied, we will invite and grant the agency access to apply through ODOT's grant management system, which is Black Hat. Now, Black Hat is subject to change. I know there has been some conversation about switching to, or possibly switching to, a different management system in which we will review 5310 grants or 5310 applications. But for now, we do use Black Hat. They can advance to the next slide. And then I have here just a picture of our funding cycle and where we currently are now. So if you do look, I'm on the left side, I'm not sure if it's the same for you, but if you do look towards the left, we're in the middle of October and December where our contracts are being awarded and our funds are being encumbered. And this cycle really just gives an overview of our grant program cycle for our calendar year and fiscal year. So again, the letter of intent submission is due in February, and then that mandatory application workshop we do have in April, or we do have in March and April. And then we begin the application period. Now the application period is in which we give the applicant time to actually gather the materials to submit the application. It is a pretty lengthy application, but we do give our applicants at least 6 weeks to fill out that application. Now, COVID-19 did change that application period just a little bit with everyone actually working from home. We wanted to extend the amount of time that an agency or an applicant had available to actually apply for the program. With everyone working from home, it was a little difficult to receive signatures, and so we wanted to make sure that everyone had time to do that. So we did push the due date for the application back, which also pushed back our award announcement date. We usually do make the award announcements in July, but because of the pushback for the application due date, we did make those award announcements early in August. And then now we are at the contracts awards and funds encumbered, and then after we do move to the award projects being completed. And you can advance to the next slide. Okay, perfect. And I wanted to talk about the calendar year 2021 project selections and a little bit about the 5310 program and the competitiveness of that program. You can advance to the next slide. Perfect. So Section 5310 is a competitive application process and is a discretionary program. So there is scoring criteria that is actually in place that we use to review each project. And ODOT does have a point system. So we look at the general information of that application to ensure that all of the documents have been completed and submitted on time and then also have been signed. So that is a scoring section for itself. And then we also have scoring for capitalized maintenance, operating, and vehicles. And so each project is scored within projects within its category, and each section has its own point and scoring criteria. In our calendar year 2021 program guidance and instructions document, in that actual document, we do provide applicants and new subrecipients with our scoring and points criteria so that when an agency is going to apply, they can kind of look to see, this is where my project may fall in regards to point and percentage wise. And then we do prioritize our replacement vehicles over our expansion vehicles. Now, this doesn't mean that an expansion vehicle won't be awarded. It's just that we want to ensure that we are maintaining a state of good repair. So we do prioritize those replacement vehicles over expansion vehicles. And in most cases, I do have returning subrecipients that apply for the program continuously year after year. And then again, projects are scored against projects within their categories. So when I am scoring projects, I'm scoring all capitalized maintenance projects with capitalized maintenance, all operating with operating, and all vehicles with vehicles. More specifically, replacement vehicles are scored against replacement vehicles, and expansion vehicles are scored against expansion vehicles. So we do not mix the scoring. And you can advance to the next slide. Perfect. So again, award announcements were made this year, August 12th. And I wanted to just give an overview of the available funding and the request that I received for calendar year 2021 5310 and the projects that were actually funded. So for rural and small urban, I did receive a request of roughly little over $7.5 million in request, and the amount that I had available for each area. So for rural areas, I had about $2.9 million available to fund, and then for small urban, about $1.9 million available. And with the amount of funding that I had available, I was able to award a little over $4.3 million in projects, which is really exciting for this year. So that amount went for 1 computer hardware and software project, 7 capitalized maintenance projects, 54 specialized transportation vehicles, which does include both expansion vehicles and replacement vehicles, and then 6 operating assistance projects as well. Then you could advance to the next slide. And then I wanted to also mention that ODOT, Office of Transit, we are working on transitioning to a new website. So our old website is down and we are working to build a new website. And so with that being said, I am working with our IT team and our data manager coordinator to update information on the specialized transportation program website that would provide more information about the program. I have my contact information listed here, but I know when India sends out the presentation, I do want to encourage you all to select the link here, which would provide you with more information about the program. Then I also have my contact information here, just in case you have any additional questions. I do let our subrecipients know, I have many that always say, I'm sorry, Kierra, to bother you so much. I know I call you so many times, or I send you a bunch of emails about 5310, but I always let them know that no question is a dumb question. I really work hard to be the 5310 program coordinator, and any questions that you might have, I am more than happy to assist. So please feel free to either screenshot my information or take my information down. I'm happy to answer any questions that you might have, or if there's a project in your service area that you think might be able to be funded through 5310, I'm more than happy to discuss and see how that might fit within the program guidance and instructions. And thank you.
All right, Kierra, that was great. And I hope you guys actually enjoyed her going over what her program is all about, because it is a great funding opportunity if you're able to meet all of the criteria and guidelines to be able to get that type of assistance. So I just want to thank both of our great speakers that we're looking at right now today, because they took the time during the pandemic to be here with us today. Again, I want to thank everybody who's done these in the past. I am new at helping to bring these type of great projects together. I want to thank the DD Council, of course, and just everybody who took the time out today to attend. If anyone has any questions for either one of these two, this will be the time that you can feel free to type. There should be a little box that everyone can see where it says questions. You can kind of type in your questions. And then, of course, with the information that I'm going to send out to everyone, both of their contact information will be included in that. And you guys can always feel free to ask questions at a later date, on an individual, more private basis. This recording will be available on Services for Independent Living's website, and I also will contact the other entities at B and see if they can also make it available. And again, both Molly and Kierra's presentations, you will get in an email along with just a satisfaction survey. This survey is important because it gives me information on if you learned anything new today. Was the information that we presented today helpful? Things of that nature. So please do take out the time to fill that out and send it back to me when you receive it. So let me check and see if I see any questions. 1 second. I hope that I am looking in the right spot. How about that? But yeah, you both have really great programs, and I just wanted to shed some light, on each one of your opportunities that you're actually allotting out to, organizations, businesses, and then just people who are in need with, all different types of disabilities, and our aging community. We can't forget about our aging communities as well. I didn't know anything about, Molly with, the 211 and Lyft project. So that was awesome. When I heard about that, I had to hunt you down and I had to get you on here. And Kierra, you're just so knowledgeable, on so many different things. It's like, okay, well, can we borrow you for a few other things here? So I also hope that the audience is, listening to your information and also thinking of other, maybe in the future, they can actually team up with you guys as well for projects that they may have, going on that they want to present out to the world. Okay, I got someone, George said that you both did a great job, so that's awesome. I hope that you guys were so informative that we don't have a lot of questions because you guys just gave them all the answers. All right, so I don't see any, let me see, I do see something else it says right here. Oh, okay. Actually, my screen is just weird. I do see this. Okay, we have someone that says, hi, this is Joe Stevens. I am not sure if you can tell what type of transportation issues are you seeing? Are these new and what resources are you able to share? They didn't say who that was for, but the question again was that they wanted to know if you were able to tell what type of transportation issues, have you been actually seeing currently? Like, is it more so people just not having transportation, like Molly, when people call in for you guys? Is it because, and do you actually get a lot of calls? Because like you said, it's for non-medical transportation. So do you get a lot of calls for people who actually have, regular appointments as well?
Yeah, we have people that call us with all sorts of different kinds of transportation needs. And it can be a barrier for some folks. So even though we do have some programs that are available, there's some local cities that have senior transportation vans. We've got the paratransit program. There's other programs out there where transportation's like a secondary service. So like somebody might be having to go to an agency for, let's say, case management services or home health services, and then as being a participant in one of those programs, they may also be able to get some transportation from that agency. But there's always going to be some sort of barrier. So even though we have in Cleveland, a pretty robust RTA system and the paratransit program, sometimes there's still going to be barriers for folks because maybe they don't have the funds to pay for the transportation, or maybe like with paratransit, you have to schedule it so far in advance. So if your doctor calls and says, well, we need to get you in for this test right away, or, oh, I had a canceled appointment, I can squeeze you in, or even a return trip from the ER, even though there's other transportation programs out there, sometimes it's still a barrier due to finances, due to time constraints, or due to the service area of the transportation. So like maybe a senior center might provide transportation for their clients, but it's only in like a certain mile radius of the senior center. So there are programs out there. Some of them are very specialized. So they might only serve a very specific geographic area, or they might only serve clients of a particular senior center or of a particular program. So, what we
Speaking
would
of
do if
that,
somebody,
where is the program that you're talking about as far as the Lyft and the 211 together? Are they offered anywhere else, like in Ohio? Is it just Cleveland? Like, what areas is this program specifically targeted for?
also in Ohio, Summit County, so the Akron area has a partnership with Lyft, but they're actually using their rides for a different purpose, not limited just to seniors, but it's specifically for folks in their community that are having difficulty getting to certain food pantries.
Okay.
So they're using their rides that way. So there's 18 different markets across the U.S. Cleveland and Akron are the only two that are participating within the state of Ohio. But with each of these markets, they've decided to use those rides for different purposes, whatever is they determine is a bigger need in their community. So for us, there have been some funding cuts with some other programs that provide transportation to seniors. In the Cuyahoga County area. So we felt for the last couple of years that we would best utilize our rides for our older adults that need medical transportation.
Okay, and then you just have a few people who wanted to know when does the funding for this program actually end?
End of the fiscal year, so end of June of 2021. We are hoping that it'll get refunded. This is our third year partnering with United Way Worldwide and Lyft, so hopefully everything will continue and we'll be able to continue to provide this service for the community. But as it stands right now, the grant ends at the end of the fiscal year.
Okay, and if someone wanted to contact you guys to get more information about this program or to even become a provider, would you want them to contact you, or should they just go on a website? Or
well, for immediate service, they should just dial 211, or they can go on our website and live chat with somebody. That way they can get some answers immediately, and then if it's something that's a little bit more complicated or something where if you wanted to do me to do a presentation for your group or anything like that, then contact me directly, of course. But as far as getting some immediate service, just call the number.
okay, and then as far as CEUs, I did not offer CEUs for these transportation webinars. I do have a few other projects, webinars, workshops coming up. And since I do have a lot of your emails, I will send out, advertisements for any future upcoming webinars or workshops I have coming up that will be offering CEUs. I saw that was one of the questions. Kierra, as far as the being able to apply for the funding, how long of a wait would you say it usually is between the person actually turning in their application and everything and then actually getting a reply?
Of course. So this year was just a little bit different. We usually give agencies about 4 to 6 weeks to actually apply, and then we spend about a month reviewing applications. Now, because the application period changed a little bit due to COVID-19, I had about 3 weeks to score applications, and then between the month of July and then submit the recommendations to our governance board and management. So an agency would possibly receive an answer back within about a month to a month and a half.
Okay. All right, and so I see a lot of comments about just how much of a great job you guys did. So that's good. Even though we had a few technical difficulties, I appreciate everybody being patient and just hanging in there with us. So yes, this recording will be made available. I will get everyone's presentation to everyone that attended here, as well as the satisfaction survey, so that way we could just get the okay we presented some great information that you guys either this was new to you, you didn't know, or that you could possibly use in the future. If anyone else has any other questions, their contact information will also be included, so please feel free to reach out and ask them any additional questions you may have. I want to thank everyone for their attendance today. Thank you, Molly. Thank you, Kierra. And I hope that everyone has a great rest of the day. Thank you.
Thank you.
Bye, everybody.
Thank you. Bye, everyone.
Bye.
Bye.